Hi everybody, I'm Dr. Jon LaPook. Welcome to a special edition of CBSDoc.com. Today we're going to talk about Alzheimer's disease, which is a devastating illness. Over 5 million Americans have it right now. That number is expected to increase to as many as 16 million by 2050. And I'm here today with Dr. William Thies, who's the Chief Medical and Scientific Officer at the Alzheimer's Association. Dr. Thies, thank you so much for joining me.
Happy to be here today, John.
More than 5 million Americans have Alzheimer's. That's expected to rise to as many as 16 million by 2050. And when the baby boomers start turning 65, it's expected that about 1 in 8 of them will eventually get Alzheimer's. What's going on, and what should people be doing about this?
Well, I think people should be demanding that there are more resources put toward finding better treatments for Alzheimer's disease. We don't have definitive treatments as we speak. We can certainly all read the demographics and see that there's going to be an epidemic of Alzheimer's disease over the next 30 or 40 years. It is a very expensive disease. It has the potential to bankrupt our healthcare system, and we're not doing enough to avoid this sort of awful future.
So, other problems like heart disease are going down in terms of the deaths, and yet we're seeing a rise in the death rate from Alzheimer's. And I guess what's happening is as the population gets older, because about 95% of patients who develop Alzheimer's are over the age of 65, as our population ages, we're seeing more people who have Alzheimer's. Is that right?
That's certainly true. We also are seeing the population age because we have successful treatments for heart disease, cancer, and other chronic diseases. Every person we save from a 60-year-old heart attack is a potential person that develops Alzheimer's disease later on in their life. And those death rates are going down because we've invested significantly in the kinds of research that finds us answers to better treatments.
And I saw a very fascinating statistic to me. 100 years ago, only about 40% of Americans lived to 65, and now that number is up to about 90%. So of course more people are around to get Alzheimer's. So for the people who are out there watching, what causes Alzheimer's? What's the leading candidate? What's the major suspect right now?
Well, in fact, we don't know exactly what the very first event is in Alzheimer's disease. We do know that two kinds of proteins in the brain accumulate in excess. That's amyloid and tau. And as they accumulate in excess, they kill neurons, they get in the way of neurons connecting to each other, and eventually that's what gives you all of the symptoms of dementia.
All right, and we've seen that the amyloid plaques, with this gooey protein that interrupts the synapses and stops communication between nerve cells, and the tau tangles, which are inside of nerve cell and goof up the operation of the cell. Those are around. All people who have Alzheimer's have amyloid. Not everybody has tau, right? But when you're out there trying to do these studies to get rid of amyloid and even get rid of tau, so far they've only had mixed results. And why do you think that is?
Well, one of the reasons is that we haven't had very many studies, and we haven't had the best tools in the world for limiting amyloid accumulation. We have only the smallest experience in limiting tau accumulation. So we're just at the beginning of finding medications. If we were to draw a parallel, it would be at the first moments when we were able to lower cholesterol. The drugs that we used for that were actually not very good and fairly uncomfortable to use. But as we continued to invest in research, we found effective and well-tolerated agents, and so what we need is simply more work on Alzheimer's products that potentially will limit both of those proteins and do other things, including decrease inflammation in the brain, regularize cell cycles, which means cell division in the brain, and a number of other possible mechanisms.
I found that analogy to cholesterol and heart disease is a great one, right? Because if you wait until somebody has 5 heart attacks and then is in heart failure and you give them Lipitor, it's not going to do very much, right? So I went up to Harvard and I met with Dennis Selkoe, Dr. Selkoe, of course, who's one of the leading proponents of the amyloid theory, and Teresa Sperling, who's a physician who's actually trying to see, can we diagnose Alzheimer's earlier in the hopes of treating it earlier, because maybe we're just treating it too late, right? What are some of the new tests that have been used to diagnose Alzheimer's at an earlier stage?
Well, certainly people are now looking for biological ways to diagnose Alzheimer's disease. Currently, we diagnose the disease by talking to people. That's extremely imprecise. So what we would like is the equivalent of a pregnancy test for Alzheimer's disease, something that's simple and inexpensive and extremely accurate and identifies Alzheimer's disease before it's symptomatic. There is good evidence that the pathology of Alzheimer's disease really starts 10 to 15 years before one sees symptoms. That's when we should be treating people, because that has the potential to prevent the disease from occurring. And that's exactly what we do currently with atherosclerosis. We understand the underlying pathology of the disease, we treat that underlying pathology, and that's what alleviates the catastrophic heart attack that comes later.
Well, that was one of the things I found so fascinating up at Harvard, and Dr. Sperling was explained to me that on PET scans, you can use a special scan called a PET scan to actually stain for amyloid in the brain of somebody who's alive. Previously, you only found it at autopsy. So now you find amyloid present, and now the question is that going to lead to Alzheimer's? And she did a fascinating study recently using functional MRI, looking at how the brain actually works, to show that in patients who are over the age of 65, who seem to be perfectly fine, about 30% of them had amyloid already. And even on functional MRI, there was the beginnings of some problems in the memory centers. So then that poses the next question, which is, who should we be treating? And I guess the Alzheimer's Association is part of ADNI. Can you explain what that is, what the anagram is, and why that might help us with early diagnosis in terms of finding markers, things that are simpler to do than these fancy scans?
Sure. ADNI stands for the Alzheimer's Disease Neuroimaging Initiative. It is a large multi-center study being done all over North America, which is looking at patients that are normal, that have Alzheimer's disease, and patients that have an intermediate condition called mild cognitive impairment. They are not only looking at some of the more common imaging techniques, the MRI and PET scan, but they are also looking at amyloid-specific PET scans, and it has a very vigorous chemical biomarker arm, which is looking for changes in blood or cerebrospinal fluid that may tell us about the early stages of the disease, the stages before people actually begin to have memory problems.
So that was what was so fascinating to me. I'm sorry to interrupt, but that business of correlating the changes that you see on PET scan and on functional MRI with simple tests like blood tests or spinal fluid or urine or even skin. And then so eventually, in terms of having a large screening test, an easy, simple screening test, maybe the first step is to do something simple, a blood test or urine, and then later, if it shows something abnormal, then go on to the fancier tests?
I think that's a logical outcome. I mean, there are a number of what ifs there. It's how good is the screening test? How cheap can we make the more technologically intensive scans? I think those are answers that we won't have until we've actually done studies with the appropriate test. But certainly what you've laid out is a very logical scenario for how we would eventually deliver early diagnosis in Alzheimer's disease in medical care, not in a research environment, but actually in medical care.
Well, you know, I think what people want to know out there is that little memory problem they have. They're in the middle of a phone call and they don't remember who they dialed, or they see somebody they know so well and they can't think of their name. And I think so many people out there wonder, certainly in my practice, I'm a practicing internist, you know, is it just normal aging or is it Alzheimer's? So I guess that remains research for the future. And in the meantime, we are still without a cure for Alzheimer's, so we certainly need a lot more research, a lot more work. Thank you so much to Dr. William Thies, who's the Chief Medical and Scientific Officer at the Alzheimer's Association. Bill, thank you so much for your time and for your expertise.
Happy to do it.
All right, and thank you for joining us. I'm Dr. Jon LaPook for another episode of CBSDoc.com. Good day and good health.